So this video is going to be about NAFLD, that is non-alcoholic fatty liver disease. Classification: simple fatty liver disease or non-alcoholic fatty liver disease. Benign prognosis. Okay. NASH is non-alcoholic steatohepatitis. It is associated with fibrosis and prognosis to cirrhosis. Are they saying like progresses to cirrhosis? That's right. So simple fatty liver disease, SFLD, and NASH, non-alcoholic steatohepatitis. First one is benign. Second one is fibrosis progresses to cirrhosis. Etiology and pathogenesis. So like alcoholic naka, we know the cause is alcohol. இங்க தான் குடிக்கிறதே இல்ல. So what is the cause? Most individuals with NAFLD have insulin resistance but not necessarily overt glucose intolerance. Insulin resistance is there. The current two-hit hypothesis explains why not everyone with fatty liver disease develop a hepatic fibrosis. The first hit is steatosis, that is fatty liver, which is only complicated by inflammation. If a second hit occurs, leptin is then needed to cause hepatic fibrosis. So leptin is the key. Leptin is the key. So the first hit is the fatty liver, and the second hit is inflammation. Yeah, and inflammation anchinaka next one the leptin takes over. Leptin does fibrosis and all. Okay. So that's the distinction between simple fatty liver disease and NASH. That's right. Causes of NASH includes diabetes, obesity. So like two predisposing factors for COVID, diabetes and obesity. TPN, total parental nutrition. Hepatitis C, Wilson disease genotype 3, drugs, steroid, tamoxifen and estrogen. Okay, all these. Oh, actually drugs like estrogen are also going to cause it. Estrogen, tamoxifen and steroids. Okay, obesity, diabetes, steroid, tamoxifen, estrogen, TPN, total parental nutrition, Wilson disease genotype 3, hepatitis C. Gallstone is not a cause of NASH. NASH is associated with diabetes, obesity, dyslipidemia, increased insulin resistance. Clinical features: most patients have asymptomatic but have abnormal LFT, particularly elevation of transaminases or isolated elevation of the GGT, that is gamma glutamyl transferase, may present with a complication of cirrhosis such as variceal hemorrhage or hepatocellular carcinoma. Okay, so like NAFLD can present with complication like cirrhosis or variceal bleeding or hepatocellular cancer. Well, simple NASH presenting with cancer is like the worst nightmare ever. In contrast to alcoholic liver disease, NAFLD is most likely diagnosis in a patient abuse and negative chronic liver disease screen. Nasty. So what like okay, whatever. Most common cause of cryptogenic cirrhosis is going to be NASH. LFT, AST, ALT raise, but not more than 2 times normal. ALT always more than AST. That is a liver T. A liver thing is more than AST. Okay. Elevated alkaline phosphatase is seen in 30% of the cases. So ALP is high, AST, ALT are high, but ALT is more than AST. It is important to differentiate the simple fatty liver disease, which does not need follow-up, from NASH. NASH needs follow-up. Elevated transaminases greater than twice the upper limit, the normal, and the presence of metabolic syndrome, for example, hypertension. So like BP is high, hypertriglyceridemia, diabetes mellitus, BMI is elevated more than 25, especially truncal obesity are usual predictors of NASH. Hypertension, hypertriglyceridemia, diabetes, elevated BMI, and truncal obesity. Okay, liver biopsy is also there. Histologically, fat deposition is usually macrovesicular fat seen in acute fatty liver, Mallory bodies, neutrophilic infiltration, and pericellular fibrosis. So Mallory bodies வந்து இங்கேயும் பார்க்குறோம் நம்ம. Management வந்து weight loss, orlistat, metformin, ursodeoxycholic acid, pioglitazone, this is thiazolidinediones, vitamin A, which is an antioxidant, bariatric surgery. So this is about the management of NAFLD. Weight loss results in reduces the serum transaminase levels and improve the liver fibrosis and reduce the insulin resistance. So transaminase is going to become less, fibrosis will be improved, insulin resistance will be gone also. Orlistat, metformin is the first line drug in case of type 2 diabetes mellitus with NAFLD. Thiaglitazone also improve the liver function test in NAFLD. Antioxidant, vitamin E, bariatric surgery, and ursodeoxycholic acid. Okay.